Welcome back to One Awesome Autistic. If you're new here, then welcome. I'm Lee and I'm autistic and I also have ADHD. When I was diagnosed as autistic, something that was completely new to me was the term echolalia. I'd never heard of it before and I didn't know what it was or if I even had it. Now in this video I'll explain what the different forms of echolalia are. So if you know that you have it or you identify with one of these forms that I'm going to talk about, drop me a comment below and let us know all about it. Before we get started, if you like this video, you like any of my videos, then please click the subscribe button and hit the bell icon, and that way you'll get notified of any more videos that I do as well. Would super appreciate it. I love all my subscribers. You're all awesome. Thank you very much. So what is echolalia? It's such a hard word for me to say, and I'm going to have to say it probably a lot of times in this video. But echolalia is basically word repetition, and it's actually a normal part of childhood. Pretty much any child will get echolalia because it's about children learning to talk, and when they learn to talk they'll often repeat words as just a way of learning them. Will also often respond to questions with a word from the question you just asked. For example, you ask the child, do you want some milk? Instead of responding with yes or no, they'll respond with the word milk. And this is a very natural step in a child's language development. With autistic people, you don't grow out of echolalia. Echolalia will stay around. But not everyone who is autistic will have echolalia. And they'll also have it in different forms as well. There's quite a few forms of it. When being assessed, I was asked if I repeat people's words back to them, but I don't, so I'm not classed as having echolalia. But what I think I have is similar, but I need to look into it more. There's a different word for it, which is palilalia. I'll get more into that another time soon because I want to do a lot more research on that and figure out whether it is something that I have or not. So it's a little bit more self-discovery from me, which is always good. So in short, echolalia is repeating somebody's words back to them. There are two types of echolalia as well. There's interactive and there's non-interactive echolalia. Interactive echolalia is when the repetition is used as a way to try and communicate with someone, and this is broken down into 4 variations. You have turn taking, which is used in repeating phrases to fill in an alternating verbal exchange. Lots of big words for me. And then there's verbal completion. So someone completing a task may then say to themselves, good job, as they're used to hearing this after task completion. The third of the interactive type is providing information, which is where there may be a communication problem. So if the person is asked what they want to eat, they may respond with singing a song from an advert of a food product to represent what they want. And then finally, the 4th version of interactive echolalia is request. So instead of telling someone they want something, the person with echolalia will ask a question. So instead of saying they want to go shopping, they will ask, do you want to go shopping? Now, this is a lot of information, but stick with me, guys, because we are nearly there. Now we're going to talk about non-interactive echolalia, which doesn't seem to be sort of like asked about when you're assessed. I was asked about the interactive type, but I was never asked about interactive echolalia. But this is where it's a form of communication, but rather it's more rather personal use, such as for self-stimulation than as for communication. And it's also broken down into 4 different forms. First one is non-focused speech. So this could be repeating a favourite phrase or a soothing technique. Now, anybody that watches the show Atypical, I've watched a few episodes of it, but it's shown quite early on that the main character repeats types of penguins as a soothing technique, and that's what the non-focused speech echolalia is. The next version is situation association, where speech is triggered by something, which could be seeing a store and repeating the motto from the store's advert. So anybody in the UK, I don't know if Lidl is in any other countries, but you know, could walk past Lidl and start repeating the motto, every little helps. that is that form of echolalia. The third is rehearsal. This is pretty straightforward. It's repeating words to yourself in preparation for actually saying them in conversation. And I'm pretty sure most autistic people do this. I've definitely seen a lot online of people saying, do you ever rehearse conversations before you actually take part in them? And I think that's because with autism you often get anxiety, and because we don't get societal rules and things like that, that we will often practice conversation we know we're going to be going into. Now the last form is self-direction, and this is different than just talking to yourself, because I know a lot of people just tend to talk to themselves, like walk in the room and like, why did I walk in this room? But this is a little bit different. It's utterances that you do to get yourself through a task. It's something that you do from start to finish of task. So if you're making a cheese sandwich, you'll say to yourself, get bread, get butter, get cheese, get knife, get plate, butter, bread, and so on until the task is complete. And like I said, I think it's a little bit different to just talking to yourself, because maybe it's start to completion of task that makes echolalia. There are treatments available to help with echolalia as well. So speech therapy, particularly during childhood, can be a big help. And this is why some autistic people or anyone with echolalia may take their time to answer, because a common technique used in speech therapy is question, pause, answer. So you ask the person, the therapist will ask the person, what is your name? But the person is only allowed to answer when the therapist points to them. So this gives them time to pause and to think of the answer rather than just repeating the word name or something like that back to them. Now, echolalia can be more pronounced when stressed or anxious, so medication to treat anxiety can also help as well with this. And that, guys, is what echolalia is. So hopefully that's been a little bit more informative for anybody that is seeking diagnosis, may think you're autistic, or for anybody who wants to know a little bit more about autism as well. This is just one thing in the whole spectrum of things that autistic people can have. Now, everybody who is autistic will have the same issues, the same problems, the same traits, the same personality quirks. You meet one person with autism and you have met one person who is autistic, and that is it. So thanks for watching this video, guys. If you enjoyed it, give it a like, and I shall see you in the next video. Bye for now.